Hello, everyone. My name is Brian. I am very excited to have an opportunity to introduce you to a friend and colleague that I've known for the last 12 years, Dr. Gary Kloberdanz. And I want you to have the opportunity to meet him, and through this medium gives us a real nice opportunity because you get to do that before you even step foot in the office. And so if you're looking for orthodontics, then I highly recommend Dr. Gary Kloberdanz. Let's jump right in. Gary, thanks so much for being here, and please tell us a little bit about yourself.
Thank you, Brian. I appreciate the opportunity to do that. I'm a Colorado native. I was born in Sterling, Colorado, which I call just barely Colorado. And my family were Germans from Russia. And in the Germans from Russia ethic, you better work hard. So I've learned to work hard. I do have a practice in Greeley, Colorado, and also in Fort Morgan, Colorado. And they keep me pretty busy, so I'm happy to serve the people that are fortunate that we're fortunate to treat.
Wonderful, very good. Well, let's jump right into kind of some of the basic questions that people tend to have. One of the first things that comes up is that when you see any advertising for orthodontics, there's almost always a free offer, like a free exam, free consultation. Tell us what that's about, and is there a catch?
It's a good question. We didn't always used to have free examinations, but I think the last probably 10 years or so, most orthodontists have gone that way. And basically an examination means that you would call an office, our office, we would make an appointment for you. Typically what we do is we send you some materials, or you can fill out materials over the internet. Those materials are received by our office, or you bring them in. You then meet our receptionist when you come into our office, and our treatment coordinator, Christy, will come out and greet you. She'd bring you back to the examination room, where she would take a series of intraoral and extraoral photographs. She'd put them on our video imaging system, which is called a Dolphin imaging system. And then we sit down with the patient, or with the parent and the patients, and review what their teeth and face looks like. Because with the computer, we're able to blow up images and give them a much more accurate idea of what are the problems that we need to address and why are they needing orthodontic treatment. So the consultation or the examination is free. At that time, however, if the person is ready to proceed with orthodontic treatment, then what we do is we ask their permission to take diagnostic records. And diagnostic records are x-rays, pictures, and models, the kind of information any orthodontist needs to figure out what to do. That usually takes about a half hour or so to do. And then the parents or the patient would come back, typically in a week or two. We'd sit down and discuss with the information that we've taken previously what their particular issues or problems are, and what the best treatment plan to address those issues or problems is. So okay. The examination is free, it's a big bargain, and it's well worth it.
Wonderful. And so there really is no catch. It's not like you're going to leave something out or not do something. I mean, it really is an opportunity to get to meet you, meet the team, get to see the office, and find out just what you're all about.
Exactly. You're right. There is no catch other than we're here to help you, and we're here to give you the best information that we can.
Wonderful. Okay, well, let's move into kind of the next question that comes up a lot is, why should someone choose you? I mean, there are other options there in Greeley. Why you?
In our particular situation, I am now currently the senior orthodontist in Greeley. I've been here the longest of all the orthodontists. Some people see that as an advantage. I've got more experience, over 30 years of experience. Some people say, gosh, maybe he isn't current in new techniques. Well, I'm the past chairman of the Council of Information Technology for the entire population of orthodontists in the nation, and I oversaw every new advance that came out orthodontically. So not only do we offer experience, but we also offer high-tech treatment in the sense that we're using the most advanced braces available. We use what are called Damon braces, which are low-force, low-friction braces. We use TADs, which are temporary anchorage devices. We do a laser. I'm one of the few orthodontists trained with lasers. So everything new that's happened in orthodontics, we've incorporated into our practice. And one nice thing is that we don't charge for those additional procedures. We consider that a value-added treatment. So we offer you experience, high-tech. One last thing is I'm extremely proud of our staff, they're very friendly, outgoing people. They want to get to know you the same way that we want you to get to know us. And so I'd say we're not only experienced, high tech, we're also high touch and caring people. So I think if anybody gives us a chance, they'll see that and they will want to stay and come here.
Wonderful. Well, that brings us to kind of my last question. I mean, we know why we should come see you. Is there a question that I haven't asked that you would like to tell people that are watching today?
There's one question that we had discussed previously, and that is in our office we do a lot of phase 2 treatments. Phase 2 treatments mean that we treat children 8, 9, 10, or 11, and if they have jaw issues, which in our population in the world, 2/3 of people walking around, myself included, have smaller lower jaws than their upper. So if that's the case, then we want to aim our therapy at doing something to stimulate that lower jaw to grow forward. So we use a device that's called an expander Herbst. That's sorry for the name, but what it does is it widens the upper jaw, which is necessary as we get the lower jaw to grow forward. We actively widen the upper jaw, passively widen the lower. The patient wears a device where they bite forward, and biting forward we stimulate the growth areas in the jaw joint to grow forward. So as a result of that, we've been able to save many patients extractions, or in the worst case scenario, orthodontic surgery where the jaw has to be lengthened. So phase 1 treatment is expansive orthopedic treatment, jaw-changing treatment. It's usually done for juveniles. And then phase 2 treatment is conventional braces that most people are used to thinking about or most people are familiar with. So phase 1, or jaw-changing, phase 2, tooth straightening. And we do a lot of that, Brian.
Okay, well, so it's kind of designed to help the patient get things moving sooner, and so that makes the treatment later a little bit easier on the patient. Is that the idea?
It does. And the kiddos, when they're in their juvenile growth bursts, are much more cooperative than we get those teenage years. Those teenage years are a little bit tougher. But when they're younger, it's amazing how they're good soldiers and good soldierettes and do what they're supposed to do. And it works very well.
Oh, wonderful. Well, very good. Well, that's pretty much what I wanted to cover today. Thank you so much for everyone that is watching. Hopefully you've enjoyed getting a chance to meet Dr. Kloberdanz, or as we like to call him, Dr. K. And please feel free to call the office, schedule your free exam, or click on any of the links that you see below for more information to the website, anything that we can do to be of service. But do give them a call, set up that free exam, and I think that's it for today. Thanks so much, Dr. K. Have yourself a great one. That's it.
Thank you, Brian. I appreciate your help.
All right. Bye for now.
Bye-bye.